is a medical problem as well as it's a social problem. It's a medical problem because demented people, they have many problems, neurological problems should be looked after, and medical problem, medical diseases. But social problem, it is very, very important because the demented patient at one stage, as you will see shortly, needs 24-hour care. And sometimes this 24-hour care is not available. لكن luckily احنا بمجتمعنا good family ties موجودة، الترابط العائلي موجود. لكن كن outside, most of them they will be sent to nursing home. But even in the nursing home, they have difficult to deal with. Now, we'll highlight in this lecture about the most important points about the dementia. About dementia. شباب تجالسين بالأخير. شباب ثلاثة بالأخير on the left side. تعالوا قدام شوي. إيش جلسوا قدام شوي بالأمام حتى تسمعوا كويس وتستفادوا. ليش تنشغلوا بسايد توك؟ ما بيصير. Okay. So to start with, we have to define what is dementia. هذا term شاسع. لكن scientifically, how to define dementia? Now, dementia, number one, it is a progressive disease. And it is a progressive disorder characterized by what? By intellectual function failure, deterioration in the intellectual function. Deterioration, progressive. The patient was very intelligent, has a good job, or he is responsible for a house or a group of people. But by the time when he got demented, his intellectual capability and ability will be reduced. So intellectual function, but it is progressive. And also later on, besides the intellectual deterioration, there is a behavior disorder, as you will see later on when we discuss in detail. And even personality changes. شو ظل بعد؟ The intellectual function or behavior or personality. This is very difficult. Like, the most important point is, especially early on, the consciousness is preserved. Patient is conscious, not impaired. But it is a progressive disease. Now, the dementia could result as a consequence of, وهي نقطة مهمة, diffuse disease of the cerebral hemisphere. Diffuse disease of the cerebral hemisphere, and maximally affecting the cerebral cortex and the hippocampus. This dementia should be differentiated from delirium. In delirium, which is an acute condition, there is acute disturbances of the cerebral function, acute, associated with impaired level of consciousness, associated with hallucination or autonomic overactivities. And this is acute problem. It's a medical emergency because of or as a consequences of toxic or metabolic or infective disorder. Patient will get intoxicated, drug, alcohol, or whatever it is, or metabolic problem, or infective problem, encephalitis. Will have delirium. So we have to differentiate both conditions. Now, dementia is not uncommon. Recently found more than 190 per 100,000. So dementia actually, it is a symptom of a disease process rather than a single disease. Symptoms of disease. And usually occur in elderly, but when occurring under the age of 65, it's called pre-senile dementia. Pre-senile dementia. Now, what is the clinical course? The clinical course is a very long one. And the rate of progression depends on the underlying cause. Some of the causes are rapid, some of the causes are very, very slow. So sometimes the duration of the disease, the duration of the history, sometimes help us to establish the cause of dementia. For example, Alzheimer's disease is very slowly progressive, over years, where post-infections like encephalitis may be very rapid in weeks' time. And on the other hand, dementia of cerebrovascular disease, this is multi-infarct syndrome, stroke by stroke, it has some time. They found that all dementia have tendency to be accelerated. يعني واحد ما كان عنده dementia واضح، لكن يصير في شيء يخلي السيمتوم تطلع. For example, change of environment. تغيير المكان. يعني الالدرلي يمكن يروح إلى مكان آخر غريب عليه أو يدخل مستشفى. تبدي symptoms of dementia. ولهذا دائما يجينا consultation for demented patient because he was admitted for non-neurological cause, medical or surgical, but change of environment or sometimes intercurrent infections. Believe it or not, simple UTI sometimes cause these dementia symptoms very clear. Or after surgical procedure, because surgical procedure is a trauma. Sometimes the dementia features become very, very clear. Now, this is very important. The development of symptoms. Now they found that introspectively, it is very slowly over the following stages. خليها stages حتى نفهمها أحسن. For example, early on, in stage 1, the patient have vague symptoms. The patient is unsure of himself. يجي هو المريض بيحكي لك يا دكتور أنا مو زي زمان، ما متأكد من حالي. أنا كنت مدير مدرسة مثلا وعندي مدرسة كبيرة طلاب مدرسين وكنت ما شاء الله، لكن الآن شوف حالي يعني I'm not sure about myself، ما بعرف شو اللي صار، هيك بيك ما يعرف شو اللي صار. ما أقدر أنا مثلا هو كمدير مدرسة أنا أمشي المدرسة كما كنت سابقا. عجبت، أنا تعجبت واللي حواليه تعجبوا أيضا. أنا كنت بريليانت يعني، بس الآن شوي I'm not sure about myself، بس ما في حد يعرف المشكلة. This is early stage 1. Then passes into stage 2. In stage 2, the patient experience having a difficulty in coping with the work or ordinary routine duty. هنا شوية تطور، بعد ما بيقدر difficulty in coping with the work or ordinary duty، ما يقدر يعمل شغله، لكن still his insight is retained. لا زال هو يعرف انه في مشكلة عنده صارت، الانسايت موجود، بس وصل الى حال انه ما يقدر يشتغل مع الشغل ماله او اشياء اوردينري روتين كان يعملها ما بيقدر يعملها. هذا stage 2. Then, for example of that, the patient have difficulty in coping with the familiar task. أشياء عادية كان يعملها، يروح يطلع يسوق سيارة shopping whatever it is, and sometimes have a problem with communication or misplacing things. خلي الشغل ينسوا نخلي كلنا عندنا النسيان، بس هو يصير أكثر من الناس. And also sometimes become very forgetful، ينسى كثير. Or sometimes have difficulty in planning or solving problem، كان وين سابقا اختلف الآن. هذا يؤدي إلى withdrawal of the patient. Confusion with time and changing of personality, changing of mood and judgment. And then we go to pass into stage 3. هون صار الأمور تختلف. In stage 3, his insight is lost. ما يعرف حاله إنه صار مريض. تسأله يقول لك أنا ما بيجي شيء. هذا طبيعي. زي الأول. طبعا إذا صار هيك that lead to behavior changes. يتصرف تصرفات ما كان يعملها. هذا الرجل الوقور الكيس اللي كان الناس كلها تحترمه كان يعمل behavior changes. هو حاله يعرف انه ما عامل شيء غلط لانه الانسايت is lost. And sometimes there is loss of inhibition. كلنا احنا عندنا inhibition، لازم اشياء ما نعملها بمكان، كيف نتكلم، كيف نحكي، هذا كلها تروح من عنده، تظل براحته. loss of inhibition. هذا stage 3. بعدين يصير advance. We pass into stage 4. And now patient is very ill. It needs long-term care. Cannot be left unattended. ما يترك الحالة، بس ينفتح الباب يطلع، إذا طلع بيتوب، ما بيعرف يرجع الحالة. يعني ستوري مرة كان مريض دمنشيا وكان يعني ساكن بالدار هو وزوجته، مرة هم كبيرة بالسن، ودائما هي قافلة الباب عليه. مرة نسيت الباب مفتوح، وين أبو فلان؟ أبو فلان ما في. طلعت بالحارة بتلف ما في. ظلوا يدورون عليه، جت عندي على العيادة، قالت لي دكتور مصيبة، طلعوا ما نعرف وين صار. Because he forget familiar places. He cannot go back to his home. اللي صار هذا بعد 3 شهور لقوا ناس بيعرفوه، لقوا جالس وسط البلد في المسجد الكبير وسط البلد، باب المسجد، والناس يتفضلوا عليه يعطوه ماني، بياكل ويرجع يجلس، بس ما بيعرف. الناس تعرفوا عليه وبعدين حكوا لأهله، اجوا أخذوا. difficult to leave him unattended. لازم واحد 24 ساعة بودي جارد. شوف كيف يدهور البشر. بعدين finally after that stage 5 patient become mute, mutism, and he's incontinent of urine and stool, mute and incontinent, and that lead to multiple repeated infection, chest infection, pneumonia, and that finally lead, unfortunately, to death. شايف شلون يتداول البشر؟ الدمنشيا. Now, sometimes, it's very important, the initial phase of dementia, which is very difficult to diagnose, may be inseparable from what we call pseudo-dementia, اللي يصير بالchronic depression illness. To a psychiatric patient, they got chronic depression, long-term depression. They have pseudo-dementia, not a dementia. Now, the intellectual function decline depends on the underlying problems. Sometimes very acute in weeks, like encephalitis. كثير من الناس after encephalitis بعدين يصير demented, but in weeks. Or subacute in months. Like for example, the Creutzfeldt-Jakob disease or normal pressure hydrocephalus. هنتكلم عليه بعدين. Or chronic in years, like the Alzheimer's. Now, how we classify it according to the cause, and we have many causes, like Alzheimer's disease, or cerebrovascular disease, multi-infarct disease, or neurodegenerative disease, like the Huntington chorea or Parkinson's disease, or infections, like Creutzfeldt-Jakob disease, or encephalitis, or normal pressure hydrocephalus. Nutritional, we should not forget nutritional, especially B1 and B12 deficiency, thiamine deficiency, Wernicke's Korsakoff psychosis, تاخذوا بالسايكاتري يمكن هذا. بسايكاتريك symptoms will be neurological symptoms, dementia, and folate deficiency. Metabolic, we should not forget metabolic causes like organ failure, hepatic failure, thyroid disease, and so on. Or chronic inflammatory disease, trauma, repeated head injuries, tumors, especially subfrontal meningioma. Again, commonly, Alzheimer is about 60% of dementia, whereas cerebrovascular disease about 20%. Look, the Alzheimer, 60%, majority. And the vascular, about 10 to 20%. The remaining, we have, for example, dementia with Lewy bodies, or we have the frontotemporal dementia, okay, and so on. important, very important, to investigate all patients with dementia, because there are certain treatable causes, especially metabolic causes or endocrinal causes. Okay? And this account about 10 to 15% to be reversed. فدائما الديمنتد بيشنت مو نقول له خلاص ديمنتد وانتهى، نعمل له انفستيجيشن تو اكسكلود، ممكن يطلع بعدين هايبوثايرويد. Okay. Now classification according to the site affected. So dementia is sometimes subdivided according to the site predominantly affected. For example, if the anterior part of the cerebral cortex, frontal lobe, prefrontal for executive function, ذكروه بالمحاضرة الأولى, which changes for personality, behavior. This is characterized by the prefrontal and premotor, characterized by behavior changes and loss of inhibition, antisocial behavior, and irresponsive. These are anterior. Example of that is the normal pressure hydrocephalus, هنتكلم عليها, or Huntington chorea, or metabolic disease. Posteriorly, in the parietal and temporal lobe, there is disturbance of cognitive functions, memory and language, without marked changes in the behavior, like Alzheimer's disease. This is cortical. What about subcortical? Patient could be apathic, forgetful, very slow, and poor ability to use the knowledge, associated with other neurological signs and movement disorder, like Parkinson's disease. Cortical, high cortical problem associated with cortical signs like dysphagia, apraxia, or agnosia, Alzheimer's disease. Now, the history in patient with dementia is very important on examination. We concentrate about, number one, for the rate of intellectual decline, أنت تعمل classification, or impairment of social function. Also, general health history. Patients have hypertension, stroke, head injuries, nutritional status, important, drug history, and family history of dementia. And we use certain tests, for example, to examine the memory, abstract thought, judgment, and specific higher cortical function. إن شاء الله نترجم بالكلينيكال نحاول لما تكون بالديمونستريشن. And simple bedside tests include, we have to طبعا put his information about his age, date of birth, and so on, and we ask him simple questions. Also examine for focal signs, or focal involuntary movement, or pseudobulbar pulse, or presence of primitive reflexes. This is all important. Glabular signs, هنتكلم عليها. طبعا primitive reflexes usually present in infancy and very old age patient and dementia. نجي على Alzheimer's disease as example. طبعا this is a common cause of dementia, and it is rarely under the age of 45. طبعا the incidence increases with age, and about 30% are familial. Now this is the brain. This is the normal brain, cortex, and white matter, normal, and ventricle. In Alzheimer, there is loss of brain mass, tissue, and that to shrinkage of the brain, shrink. And the ventricle get dilated, secondary to the shrinkage, and mainly affecting of the hippocampus. This is normal hippocampus. This is atrophied hippocampus. This is the brain. This is the healthy brain. Look, this is the healthy brain. and this is shrinkage brain. This is Alzheimer, and this is healthy. And cross section, for example, this is the normal neuron, healthy neuron. This is the dying neuron. And there is inclusion body. Yes. Now, the pathology, we find different changes. For example, we find neurotic plaques. And these are a complex extracellular lesion, about aggregations of filament with central core of amyloid. This is found mainly in the hippocampus and parietal. Also, we have neuronal loss and granular vascular degeneration. The brain is very small, as we see, atrophied. Sometimes we find neurofibrillary tangles. Now this is intracellular, pair of strand of protein closely related to the nuclei, mainly in the affected pyramidal cell. These are the intracellular. And these are different types. For example, we have these toxic. We have the tau protein, which is very important, very toxic. Who has the tau protein with the main effect in Alzheimer? Tau protein, toxic. This is the normal brain size and normal neuron. This is the shrinkage brain of Alzheimer, dilated ventricle, and dying cells. This is the tau protein, okay, intracellular, and this is the extracellular change. So again, this is the healthy brain, this is the diseased brain. Okay. How we diagnose the Alzheimer? Now, the diagnosis during life by the early symptoms, failure, and very slow progression, and excluding of other causes. This is the main thing. So, gradually the brain cells are lost. When we do CT and MRI, help the diagnosis by exclusion, multiple infarct, or other mass lesion. Look, this is the healthy brain. Normal ventricle. This is shrinking brain, dilated ventricle. Alzheimer. Now, for the treatment, usually supportive, just supportive treatment and long-term treatment. No effective treatment. Sometimes we use the certain treatment like cholinesterase to revasculate cholinesterase inhibitors. Sometimes help. But nowadays, there are a lot of research for Alzheimer's. Okay. We have another type or another entity, and that is the multi-infarct. Infarct on the infarct, multi-infarct. And this is about 10% of cases of dementia. And this is due to the occurrence of stroke by stroke, leading to the shrinkage of the brain, and reduction in the mass of the brain itself, leading to progressive loss of the function, especially pseudo-bulbar function. This is multiple infarct. Multiple. ولهذا شوف هذا الدكتور بالمحاضرة الأولى differential diagnosis between MS and vasculitis. This is outcome. an entity called Pick's disease, and this is about 5% of dementia. And usually it affects women more between the age of 40 and 60. And it affects mainly the frontal lobe. And this leads to the apathy, because frontal lobe, lack of initiative, and personality changes. And the scan of the brain showed frontal atrophy. The blood flow also reduced. And pathologically, the disease characterized by inclusions body within the cytoplasm of the frontal lobe, temporal lobe, cortex cells. And there is no treatment, and usually death within 3 to 5 years. This is the frontal lobe and dilatations of the brain. Pick's disease. Now we have an entity called normal pressure hydrocephalus. From the name, there is hydrocephalus, but the pressure CSF is normal. That means that the dilated ventricle, hydrocephalus, the pressure is raised. Like at home, the pressure is normal. That's why I call normal pressure hydrocephalus. And characterized by the following. There is dementia, there is gait disturbances, ataxia, and urinary incontinence. ولهذا دائما if you are in the outpatient أو بالcasualty يجيك elderly وعنده dementia recently وعنده ataxia, gait disturbances وعنده incontinence, think of normal pressure hydrocephalus. يمكن neurosurgery أقول لكم عليها كثير. Dilated normal pressure hydrocephalus. So this is hydrocephalus with normal CSF pressure. Now, this occurring with hydrocephalus and normal CSF pressure. Other we have two types, either normal pressure hydrocephalus with the preceding cause. كان سابقا عند subacute hemorrhage or meningitis or trauma or radiation عملت lesion. أو طبعا this must be distinguished from hydrocephalus with raised intracranial pressure. أو idiopathic, 50% of normal pressure hydrocephalus with no cause. The mechanism, how the mechanism? They said in the mechanism, the theory is that in the preceding period, وقت سابق, أنه the flow of the CSF is interfered with. There is impedance of the CSF flow, and thus lead to the raised intraventricular pressure and ventricular dilatation. بعدين يصير compensatory mechanism lead to the reduction in the CSF pressure. لكن الventricular dilatation persist. إذا هو سابقا كان عنده obstruction to the CSF, dilatation of the ventricle, raised the pressure. بعدين يصير mechanism of reduction of the pressure, لكن الventricle تبقى dilated. Now, what are the clinical features? Number one, dementia. And the dementia from pressure on the frontal lobe, possibly related to the decreased cerebral blood flow, high dementia. And incontinence is due to pressure on the cortical center of the bladder or bowel in the paracentral lobe. So, هذا incontinence. What about the gait disturbances and pyramidal sign? Due to the pressure on the leg fibers, corticospinal tract, from the cortex passing around the ventricle toward the internal capsule. And then how about explanation? A diagnosis based on a clinical picture plus imaging, CT and MRI scan. طبعا normal pressure hydrocephalus should be differentiated in the patient who has ventricular enlargement due to the brain shrinkage, like multiple infarcts or ulcer. نجي على other causes of dementia هو التروما والتيومر genetic disorder and so on. لكن by the way a neuropsychiatric testing is performed for every patient with dementia. Why? To diagnose the early sign of dementia, to separate dementia from pseudo-dementia, and to monitor the progress of trial of treatment. When dementia, or the reason of dementia is unclear, you have to do investigation to exclude the treatable cause. شكرا.